Hi, I'm Spenser Gabin, Associate Marriage and Family Therapist here at Bold Health. Today, I'm going to be talking about exposure hierarchies, which is a tool that we use in exposure and response prevention treatment for OCD. So, what is an exposure hierarchy? It is really a list of situations that we have been avoiding due to the distress that they bring up. And so for OCD, these are situations that trigger our obsessions and then are followed by compulsions. We create a hierarchy in order to really create a roadmap in treatment for here are the situations we're going to confront to break that association between the situation and the avoidance that we do to relieve that distress. So let's pull up a sample exposure hierarchy. Let's go ahead and get that pulled up. Okay, so there we go. So this is what we call a sample in vivo exposure hierarchy. In vivo really just means something we confront in real life versus just in our imagination. There is another exposure called imaginal exposure, which I will save for another video. Today, we're going to be talking about just exposures involving something we confront in our real life. So let's dive in here. First, we need to define this term called SUDS, or subjective units of distress. So we first need to create anchors actually for our hierarchy in order to be able to kind of assess where things fall in a hierarchy. We need to understand the concept of SUDS and then create anchor points. So subjective units of distress, really, it's roughly like anxiety, but it's a little bit more expansive in that it's just overall distress. And so the first thing we do is create anchor points. And these anchor points should actually not be linked to anything to do with OCD. We actually want to create ones that are based on just situations that bring up distress really for anyone. And so we have like a 0 here, a 50, and 100. So like no anxiety, medium level anxiety, distress, and then the most anxious or distressed you've ever felt. And so here, just as a sample, I came up with having coffee with your friend. Okay, that brings up like no anxiety. Then a 50, so somewhere in the middle between 0 and 100, might be speaking at your Toastmasters club. Toastmasters, for those that don't know, is a public speaking organization and club. And so public speaking, something that's going to bring up anxiety for most folks, kind of right in that middle zone. And then 100, maybe the most distressed you've ever been was actually when you were fired from your job. So we create those anchor points because as we actually move through and confront the rest of these exposures here, the subjective units of distress for the things relative to OCD will likely actually change to some degree, whereas these anchor points will not change. So of course, even if you go through ERP treatment for OCD, getting fired from your job is still likely to bring up a lot of distress. Okay, so let's dive into our actual hierarchy here. So first, let's talk about some of the themes that we might see. So for this, hypothetical sample person I created here, I gave them 3 main OCD themes. First, a fear of contamination or HIV. And then I've labeled the exposures related to that theme green in the hierarchy. A fear of harming others, I labeled those red. And then blue for a fear of being with the wrong partner. Okay, so we might have 5 themes with OCD, we might have 7, we might have 3. It really doesn't matter. This is just a way to break down that we're going to create one hierarchy. We want it to really address each of the themes. And so for the situations in the hierarchy, I created a list here and ranked them from a low-level SUDS of 25 all the way up to our highest, which is, of course, 100. So I'll walk through each kind of situation and why, I would rank at that level and kind of move through systematically here. So first blue related exposure, and then that means it's a fear of being with the wrong partner or like a relationship sort of OCD. So you might start by just watching a movie with an actor or actress that you have a crush on. And so this might be something that you've been avoiding consciously or not in your life, but to go and deliberately watch that movie with that person that you've had a crush on to invite that possibility that maybe I'm with the wrong partner and I should have found someone more like this crush, so on and so forth. Next up, we have the 30 level of SUDS, looking up statistics on rates of HIV infection to confront that theme related to fear of contamination and HIV. And so, these first two, 25, 30, it's a little bit of distress, but likely something someone's going to be able to do, and often actually is helpful early in exposure therapy and exposure PRP specifically, to find just ones that you can kind of build confidence on. That, yeah, okay, this is a little bit of distress, but I can build a little bit of momentum here to help face some of the ones further up on the hierarchy. Up next to the fear of harming others, you could watch clips from horror movies like The Nightmare on Elm Street, one like a slasher film. And so even though, of course, the movie is imaginal, you're inviting your mind to think about possibly hurting someone. And so watching something with blood and guts might bring up 40 level SUDS. Moving on, we've got watching another movie. And so going to the theme of relationship OCD and being with the wrong partner, there's a movie called Marriage Story, which is all about a marriage that, supposedly was happy, kind of dissolving into divorce. And so that would be one that maybe brings up a bit more distress. So like a 45 on our 0 to 100 scale. And then moving forward, we've got another movie. I'm a big movie guy. We could watch a movie about someone who dies from AIDS to confront that fear of contamination or HIV. And so there's a really good movie back in the 90s called Philadelphia with Tom Hanks that might bring up that, again, that sort of 50 midpoint on our SUD scale. Up next, going to the fear of harming others. Someone might be avoiding cooking, avoiding using knives at all. And so we would actually deliberately have them do that and then chop up that food without their wife in the room. So that would give them like a 60 on our SUD scale. And we'll swing back to this later on, but first I'd have them do it without their wife in the room to make it a little bit easier on them, and then we can make it hard later. So we'll come back to that one. Looking at unflattering photos of your partner can be a great exposure. Again, we're kind of building difficulty here, a 65 level SUDS. And then next we have fear of contamination or HIV, going to a syringe exchange program. Okay, now we're at a 75. This is often where exposure does get more difficult, but these can be really effective exposures. And then circling back to that fear of harming others, would bring up an 80 for this time, would be chopping the food using your knives, using the knives with your wife in the room. And so we get a 20-point increase in the SUDS level because your wife would actually be present, and then that would bring up even more anxiety. And so this is a way to kind of gradually make your exposures more difficult, is to first make them a little bit easier by having a little bit of avoidance in them, like doing it, chopping the knives without your wife in the room, but eventually confronting that avoidance and having her there to stoke up the most fear. Up next, we've got just talking to a person you find very attractive. So likely, since this would be a real person in your life, it's going to bring up more distress. And so this would all be all the way up at a 90. And then our last two here, 100, are two most difficult. And this one might seem kind of jarring, but let me explain it a little bit. Holding a knife to your wife's throat. So of course, we would want to get everyone's consent and understanding on board before we did that. But you might ask, well, why would we do something that actually goes past what a neurotypical would do? And the reason we do that is because with OCD, we actually want to overshoot a little bit what's normal to almost stamp out any of that OCD that's still lingering. And so, yes, of course, everyday people don't go ahead and just hold a knife to their wife's throat, but this can help really break that association between the knife and that fear response and that avoidance response. And then finally, visiting an HIV testing or treatment clinic might be the very highest exposure on someone's fear of contamination hierarchy. And so this, of course, is a somewhat sizable hierarchy, but likely one that you create would actually involve even much more detail in this and would zoom in a bit more. But it gives you just a general sense of how things might go. It is really important when creating your hierarchy to try to be as honest as possible about the suds level, and also just as honest as possible about all the different themes and ways that OCD shows up in your life, because that's going to help you create the most effective roadmap, so you can feel more confident and ultimately live a life more according to your values. Every exposure that you do on this hierarchy should be linked to something that you want to be able to do in your life. You want to be able to watch whatever movie you want to watch. You want to be able to, cook with your wife. You want to be able to go about the world without avoiding any place where you could possibly run into HIV, for instance. We Exposure is really hard work, but we always want to be doing it with an eye on how it's going to improve our life.